Hi, everyone. It's journalist Lisa Ling, and I'm sure you will agree that it is so important for there to be good, trustworthy journalism on children and families, and nobody does that better than the Imprint. I am such a devotee of the Imprint, and I listen to the Imprint Weekly podcast because it is so comprehensive and so substantive, and it is by far the best news source for anyone interested in critical issues like foster care, juvenile justice, youth homelessness, and so much more. During this holiday season of giving, I hope you'll consider donating to the Imprint. If you do so between now and the end of the year, your donation will be doubled thanks to the National Newsmatch campaign. To give is so easy. Go to imprintnews.org/donate. That's imprintnews.org/donate. Thank you so much.
Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business, policy, and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. You can check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web, at safecampaudio on social media. Got a short one for you today. We are just going to break down some top-line findings from the Imprint's Who Cares projects, which every year we go and collect data around foster care capacity from all 50 states. Finally got everything all fact-checked and loaded onto the Who Cares project website, which is fostercarecapacity.com. I was hoping to pair that with talking about the release of the annual foster care data that the feds put out, which is the AFCARS report. That stands for Adoption and Foster Care Analysis and Reporting System, AFCARS. But it is still not out yet. I'm betting it comes out this week, right after we drop this podcast. So stay tuned to imprintnews.org. I'm sure we'll cover that the minute it is out in public, but unfortunately not in time for this show today, which means we're going to have to discuss that bad boy in the new year because this is the last, quote unquote, new show for 2023. Next week, we will have our annual best of episode of the Imprint Weekly Podcast. We're going to feature some clips from 2023's best guest interviews. We got 20 of them lined up, so check that out in case you missed any of the action in 2023 here. Then we will be on a hiatus for a few weeks through the holidays and a little bit of travel abroad. To me, I am headed with some of my family to Tanzania, and we will be back with the podcast on January 22nd. I think I had said January 15th last week, but that is actually a federal holiday, so we will be back with the Imprint Weekly Podcast January 22nd. Okay, let's get into some new numbers we've compiled for Who Cares, and I guess I should probably start with a quick explainer on what this project is and how we do it. So the idea for this started, I want to say we launched it in 2017, at first as just a white paper, and I don't think we knew whether or not it would be something we'd do like every year. I think maybe we got the idea for this at like an annual retreat of our staff in 2016. But basically the idea is this. There's, two federal reports that come out that sort of serve as the backbone of like ongoing annual data about the child welfare system, nationally, even though there's not really a national child welfare system. One is a child maltreatment report, and that really gives you a lot of information on the sort of front end, if you will, of the system, a lot of information about reports of suspected maltreatment, substantiations of that, how many identified victims there are in a given year, what the response is when somebody is substantiated. So how many times is foster care used in that situation versus alternatives, differential response, things like that. So that's one report. And then the other report is the AFCARS report, which I referred to earlier. And that really gives you a lot of information about how many kids are in foster care, how many have entered or exited in a given year, and then demographic information about them, race and ethnicity, age, how long they've been there, mean and median time, things like that. What you don't get out of those two is any sense of the capacity of these systems as it pertains to their ability to use anything but their birth family's home to care for them. So what we sort of set off doing is to sort of say, can we on an ongoing basis answer, how many kids are in foster care today and where are they living? I think that where are they living is the thing that we're bringing somewhat uniquely to the table with what we ask. The reason that we go and try to seek a number for the number of youth in foster care, even though that's covered in AFCARs, is that the federal reports tend to lag behind quite a bit. So, for instance, the most recent federal data on youth in foster care is from fiscal year 2021. We're still waiting for the AFCARs report that will cover 2022. It'll be another year and more probably before we know about this year, right? So we don't pretend to do a better job than the system that has been created between the states and the federal government to kind of set up AFCARs. But what we'll do is go in for this project and ask a bunch of questions to states, a manageable amount of questions around foster care capacity with a point in time count of March 31st from every year that we do this. So, for instance, all the information that we have just recently uploaded, it is really time stamped to on or around the date of March 31st, 2023. So we're giving you basically kind of a not perfectly aligned with AFCAR's count of 2023 foster care for March. When you see the federal reports, their point in time reference is September 30th, which is the end of every fiscal year. So there's inherently going to be some difference there, but we're trying our best because these states certainly don't have to respond to us. They largely are nice enough to engage us on this. Very few don't. Texas, I'm looking at you. Come on, play ball. So here's a list of what we ask each state every year to provide for us as part of the Who Cares project. We ask them, as I mentioned, to give us that point in time count of the number of youth in foster care. And again, all of this, we ask them to peg it to March 31st, 2023, or as close as they can come to that. So youth in foster care is one, again, pegged to March 31st of each year. Then we ask for the total number of licensed foster homes as of that date of March 31st. Of that total licensed foster homes, how many are non-relative homes? Because from that you can determine within reason, how many licensed homes are, I don't mean this pejoratively, but stranger foster care as opposed to somebody that the child knows, especially relatives. We ask for the number of congregate care providers in the state. We ask for the number of relatives with active placements. And I would say, just full disclosure, that is probably the one with the most variance in terms of how states, interpret that or, the minutia of how they calculate it. But we do think it's important to really try and get their best answer for right now at the present time on this March 31st timestamp. How many relatives are they working with? And so that's what we ask for from each state. And then what we do is sort of buffer that with some demographic information that really only researchers can draw out of the AFCARs process. Because you get, all of us can see the annual public AFCARs reports, like how many kids are there, exit entry, some demographic information, but there's much more available to researchers, and we work with a great one who helps us kind of coordinate that so we can give you, a little bit of a round out. And it's not exactly timely. We're going with 2023 data this year. We'll update our AFCAR stuff pretty soon. Right now, we only have 2020 and before on the site, but we'll be adding, hopefully 2021 and 2 sometime soon. But the demographic information that we include through AFCARs is the percent of kids who are living with relatives, the percentage of kids living in unpaid placements as a percent, of all youth in foster care. We show, the percentage of kids living in congregate care. And then how many youth in foster care are 13 or over. And then in addition to all that, so those are all percentages. And then we provide from AFCARs the raw numbers that they use in terms of race and ethnicity, both of foster families and of foster youth. And the reason that we don't do it as a percentage is there's a lot of noise in this data, particularly around multi-race or ethnicity youth, but then there's just, lots of records where it's not identified in AFCAR. So it's really hard to, make a percentage out of it when there's such a big part of the total that's not known. So it kind of felt irresponsible. So we go with raw numbers on the race and ethnicity for foster youth and for foster families. And then one final thing that we do, and this is really a cool kind of custom calculation that we're able to feature is the family separation metric. So an organization called Fostering Court Improvement created this measure. It is based on sort of a confluence of different federal data sets that includes AFCARs, but also numbers from the National Center for Health Statistics, the Office of Juvenile Justice and Delinquency Prevention. And what it does is basically reflects the average number of days that a child spends without their family in each state. And I should emphasize, this is among all children in the state. So it's really trying to get outside of just the silo of child welfare and of foster care and really say, on a population level, how often are kids spending full days without the care of their family? And it's looking at family in the bigger picture, not just parents. So if you're living with your relative, whether that's something that is as a result of a removal into foster care or something less formal than that, but involving CPS, or if it's just simply an arrangement that you've come to as a family, that counts within family. That is not counted as family separation in that metric. So it's trying to give that kind of population level for each state. So that's pretty much what you're going to get. And if you go to fostercarecapacity.com, on the home page, you're going to get, some national data sets. So if you want to kind of see your state or any state, in comparison to all the others, you can go to those data sets on the homepage. I think we have 6 up with most of the big ones right up there for you to look, and you can kind of cross compare. But I think the most valuable thing that we do is that each state has its own profile. And in those state profiles, you're going to also be able to view the national average comparative kind of in each set. So if you just go into fostercarecapacity.com and pick any state, you can open that profile. You can see just a numerical display for several years of information, or you can click to look at it in chart view and sort of see the arc of history, of recent history for each one of those things that I described. All right, so what did our numbers find this year as part of the Who Cares project? Let's start with the number of kids that are in foster care. And just as a further reminder, the federal data, which most people kind of peg their answer to how many kids are in foster care to the annual AFCARS report. The most recent one covers 2021. I really think we'll probably this week or next see the report for 2022 data, and then it'll be another year before we get 2023. So as far as our project's concerned, the numbers for 2022 and 2023 are from us, and then we use AFCARS once it's available to kind of put that on display. So what we found in our report this year is, on the top line, the number of foster youth in America, at least who are formally taken in and placed into foster care, it continues to decline, and it's been declining for several years now. So as of our count, March 2023, there were 355,032 youth in traditional foster care settings. That is a 7% decrease from the 2022 number that was collected through this project. And it is 9% lower than the federal count for 2021, which is, like I said, included in the AFCARS report. So we're, nearly 10% down from 2021. One caveat here, in terms of how we've put this together, at least for the 2023 numbers, we got answers on this question for 49 states and Washington, D.C. Pennsylvania had a hard time coming up with one because there's one fairly large county there where there's some severe data problems right now, and they weren't really comfortable giving a partial answer, nor would we want that. So, until we can get a figure from that state, we sort of have a stand-in number for them based on the percent change overall for the other 49 states in DC for 2022. We sort of applied that to their 2022 number and project out for 2023. So again, the number of foster youth is down for, I think if you connect us plus AFCARS, down for a 5th year in a row. The recent peak in the AFCARS reports was in 2018. I think it was 438,000, call it, give or take 438,000. So if we're right and we're doing an okay job collecting this, this is the 5th year that it's down. And I do think that the federal data does end up tracking somewhat close to what we come up with. So I do think I feel pretty confident that we're in the 5th straight year of a decline in the number of youth who are in formal foster care. I keep saying formal, and there's a reason. I'll get to that in just a second. But it's significant on one level just because, in 2020, obviously, the COVID-19 pandemic shut society down. It kept kids out of school and at home. The number of youth in foster care plummeted. It was already on the decline at that point, but the drop from 2019 into 2020 was really steep. And, I think there were a lot of professionals and people around child welfare who expected that, really, regardless of of where you are ideologically on child welfare, that there would be a numerical increase at some point. There would be a rebound somewhere soon in the future of the number of kids entering foster care. As far as we can tell, that's not the case. We're 3 years out from 2020 numbers, and the use of foster care continues to appear to decrease. Now, one person who took a look at our data pointed out, asked whether or not we've ever thought of including entry and exit. I'm not sure I could get that from every state, and so I don't think we could do, I kind of come at this project from what can we reasonably expect every state to be able to provide to us as just simply a media organization. I'm not sure. But what the trend has shown with the AFCARS data, and it'll be very interesting to see if this has changed at all once the 2022 numbers come out, is that, foster care has declined despite the fact that the number of exits from foster care slowed down. So it really has much more to do with a significant decrease in the number of entries into foster care. So that's a big thing to keep our eye on as the AFCARS report hopefully comes out sometime soon. Now, one big caveat here, and you've heard me now mention that this is all referring to formal foster care. Since 2020, we have come to know much more about the use of hidden foster care. One way you could describe it is a practice of kind of shifting the physical custody of a child by way of child protective, service intervention without formally removing them via a court action and actually changing legal custody of a kid. So, for example, somebody gets a knock on the door, the CPS workers, kind of tell them, I don't think it's safe for Johnny to stay here. If we can get him over to grandma's right now while you get help or while we work with you on this or that, that'd suffice. But if that's not going to happen, we're going to come back and take him into foster care. So that's, you can tell there's some concerns about the due process involved in that kind of proposition. But that's not formal foster care. I mean, that's an example of when it might not happen. So one fairly unknowable question from the data at this point is, are systems, just favoring such hidden movements more than before, meaning less youth are in formal foster care, but really, just as many kids are living outside of their homes as there were, 2, 3, 4, or 5 years ago. So it's just kind of unknowable in two levels here. So for one, it's called hidden foster care for a reason. It is not tracked. The federal government does not require anybody to show them how many, informal diversions to the homes of kin and family friends occur instead of formal foster care every year. So there's just not a lot of good data on that. Josh Gupta-Kagan, who's a law professor at Columbia University, did a really great legal brief on hidden foster care several years ago. His research of kind of the more local studies and the information that does exist, persuaded him that there's probably as many kids that enter a hidden foster care situation every year as do kids who enter formal foster care, which would mean somewhere in the 200,000s, which is a lot. Now, so there's not a lot of knowledge about just exactly how many kids we're talking about, but then there's also not really, of course, as relatedly, a way to know whether it's increased or not. So there's no way to know the baseline. There's no way to know how much it's changed. I think it's probably safe to say that there's some states that have their numbers of entry into formal foster care is at least somewhat tied to more use informally of kin. So that is the number of youth in foster care. How about the foster homes? So we have been collecting this state data on foster care capacity, really since 2018. I think we did a 2017 count, and I think we got a baseline for 2012 from some states. But, for the purposes of the project website at fostercarecapacity.com, you can see things from 2018 on. So for the first time this year, since we've tracked it, the number of licensed foster homes in the United States is below 200,000. The number of licensed homes has dropped every year since 2019, when it was just over 220,000, and it now stands at 195,404. That 2019 total does not include Virginia at all, who didn't used to provide answers and now has. So, the decline is actually even more pronounced. And another full disclosure moment here. We got a total licensed foster home number from 49 states and DC. Texas refuses to provide a current total in year for us. They refer us back to some data from the year before. So until we can get a figure for Texas for 2023, what we do is the same deal. We take the 49 states and DC, figure out the overall percent decrease, and then we make a projection for Texas based on the experience of the other states and sort of apply that decrease, that percent decrease to Texas's 2020 total. So a lot of words to describe that. We just project Texas and incorporate them in. So the number of licensed foster homes is down. It's been going down. While the overall number is dropping, the share of those licensed homes that are kinship placements appears to be on the rise. Like I said, we ask for the number of total licensed foster homes. We ask each state to also identify how many licensed foster homes are non-relatives. And most states, not all, but most, are able to disaggregate their information in that way. So we were able to get, answers for 39 states where we could make a comparison between 2019 and 2023 on non-relatives. And there was an average decrease of 16% in the amount that are non-relatives. For many states, the decrease in the share of non-relatives was far higher than that. And that national average factors in a few states that actually saw, quite a pronounced increase in the share of their foster homes that were non-relatives. So, all that to say that it does appear that the makeup of the licensed foster home community, such that it exists, is getting increasingly populated by kinship homes, which is a verbose way of saying that there are more kin getting licensed as formal foster caregivers. And that's worth noting because the Biden administration, as we've discussed on the podcast a few times, has finalized a new federal rule aimed at easing exactly that, the process of licensing or having kin approved as foster homes and then supporting them with federally backed foster care payments. A group of national advocates have already kind of formed a model standard that they hope to use in working with states to kind of increase the reliance on kin within the formal foster care system. And I think what our numbers show is that, those advocates and the Biden administration, those efforts, there's some tailwind behind what they're trying to do, and that it seems like this is already happening. There are quite a few states where you're seeing the share of their licensed foster care, continuum be made up of licensed kinship homes. All right, so that is foster homes. Let's talk a little bit about what we found in terms of congregate care providers. And for those who aren't familiar with that term, congregate care generally refers to really any group setting within child welfare, anything from a group home, which could be, 7 or 8 beds, residential treatment centers, institutions, also shelters. So, we ask each state to provide us their number of congregate care providers. I think it's fair to say that some may interpret this differently and give us an entire universal itemized number of, sites, including how many group homes they have. And some that might interpret that to mean providing us with the number of actual providers with which they have a contract, even if that provider has, let's say that provider has 5, they're only counting that as one. Anyway, 48 states reported to us on their congregate care providers. They reported a total of 1,508 less congregate care providers in 2023 as compared to 2019, and that is a 25% decrease. The pace of decline in the number of congregate care providers appears to continue because 49 states showed a 15% decrease between 2021 and 2023. Now, I said that we ask for, several core pieces of information from states every year. We also tack on a few supplemental questions that we think we can get answered kind of while we're at it. In this year, we asked each state how many of its congregate care providers have been accredited as what's known as qualified residential treatment programs. That is a recently developed federal designation that was created as part of the Family First Act. And that law, as we've talked many, many times about on the podcast, limits federal funding for group settings to just 2 weeks. So you can use congregate care as a state all you want, but you can only tap into federal funding for group placements to 2 weeks. But that QRTP, the Qualified Residential Treatment Program, is a kind of an exception to that, because so long as courts are regularly reviewing the appropriateness of a youth being in one of those QRTPs, you can continue to draw down federal funding to put a kid in there for well beyond 2 weeks if you need. And the reason for that, why QRTPs would be an exception, theoretically, is that QRTPs are supposed to be set up to serve youth with acute health needs and work with their families to step them back into the community and back into their families after treatment. That's what it's supposed to be different. You're supposed to be accredited to be, on a different level of care, or a heightened level of care anyway. So state responses show that overall, about 1 in 5 congregate care providers in the United States now have been accredited as a QRTP. In actuality, it's likely much higher, because here's what we found. There's a cumulative 942 QRTPs that were identified by states. Probably not exactly apples to apples, but that represents 21% of the congregate care providers reported in the country. But then there's 2 large states, California and Massachusetts, who both reported technically having 0 of these QRTPs, but with sort of an asterisk attached. They both said, that they had established their own designations that were very much akin to QRTP, and that their view was that those were thus approved as exceptions under the Family First Act. And in California, the Department of Social Services there said 356 of its total 477 congregate providers essentially count as QRTPs. It's a different name that they use for it, but it's a QRTP in their view. So if you just add just the California into the total, it brings the national ratio of QRTP to congregate care providers to 28%. So this is a very superficial analysis, I will admit. But one thing that's interesting about that math is that I don't think most people would agree that exception to the rule would likely account for almost between 20 and 30% of the total available space within something. So if you're trying to say, congregate care as usual is limited to 2 weeks, and we are going to create some very specific exceptions to allow states to receive federal funding, beyond those 2 weeks, just one of the exceptions, this QRTP exception, now accounts theoretically for, somewhere between 20 and 30% of all of them. But it's not that even a story. It's not like this is a trend nationwide. The QRTPs in this country right now are heavily concentrated in 5 states. So if you assume that California is right, that what they are saying are QRTPs will count as far as the feds are concerned, and I guess I have no reason to doubt them on that. So if you count California, more than half of the QRTPs are in California, Indiana, New York, and Ohio. So just 4 states account for half. And then on the flip side of that, 14 states reported no QRTPs to us, including some very large systems such as North Carolina and Pennsylvania. Georgia was the only state that did not respond to this question, by the way. So that's the one state we don't know anything about their practice as far as licensing or accrediting QRTPs. But this is something to keep an eye on, because we were lucky to have kind of back-to-back guests this year on the Imprint Weekly Podcast, Carrie Richmond from the American Academy of Pediatrics, and then Jim Zarniak, who used to be involved in leading Onondaga County, Syracuse, New York's child welfare and juvenile justice systems, and both had, joined me after having completed, some pretty thorough research on the implementation of the Family First Act. And, I'll link to those interviews. You can actually hear a snippet from both on our best of episode next week. But suffice to say, both people's research suggested some concern within the system that people were becoming accredited as QRTPs without really changing at all, without really living up to a different standard, particularly when it came to that aftercare component and planning for, young people to step down out of there and back safely into their community and preferably into their home with their birth family. So there's a lot of concern, I think, around like rubber stamping of youth to get into these QRTPs, and then really what is different about these QRTPs as compared to sort of like any other residential center. And the fact that, in this first year that we asked, already 20 to 30% of the congregate care providers in the country are designated. It warrants continued scrutiny, I think. All right, last thing, I just want to, again, promote the family separation metric that we are lucky enough to feature here that Fostering Court Improvement puts together. Again, this is the average days per year that a child spends without family, among all children in the state. So certainly the ethos, it kind of gets to the sort of ethic or the broader ethos around family support in a state, as opposed to just simply looking only at child welfare practice. But of course, the agency who is most frequently going in and investigating and making a decision to remove children is going to factor quite a bit into, this family separation metric. And, so the lowest one, we feature data on family separation here from 2012 on. And this year, New Jersey achieved the lowest family separation metric that I have seen on here, again, from 2012 on. Their number is 0.3 for the year, which means that the average child spends 0.3 days without family in New Jersey. And that is, again, the lowest total that has been recorded. 0.4 has been clocked both by New Jersey and by Utah in recent years. Most of the other kind of lowest states frequently include Idaho, Maryland, Texas, actually, which if you listen to this podcast, they're having a very hard time with the youth who are actually in their foster care system. But they, as a state, rate pretty low in terms of like the family separation overall. Looking at the other part of the pendulum, if you will, some of the states that have the highest family separation metric numbers are, well, start with West Virginia because, it's a pretty heartbreaking situation compared to every other state. And pretty much every year they are above 3, which means that just every kid in West Virginia spends an average of 3 days outside of their family there. And of course, that's not exactly how it plays out, right? There's plenty of kids who never spend a day outside of their family, but there are so many kids living outside of their family without their kin, without their birth parents in West Virginia, that their number is just way higher than the next. And the next highest is Kentucky with 2.2. Vermont's got a 2 spot. Alaska also has a 2 spot. There's a couple in that 1.5 to 1.9 range. I feel like we should probably represent these numbers in a way that's like, it's hard to look at, single digit decimal figures and realize, just how different West Virginia with a 3 is from New Jersey with a 3. But that's just a massive, massive difference in, what's happening in each of those states. So anyway, just to reiterate, fostercarecapacity.com, we've got all of the information that we collected with the March 31st, 2023 point in time count up there. We have the family separation metric updated all the way to 2022. When we get a new set of full AFCARS numbers for 2022, we will then actually update the whole project with both 21 and 2022 numbers. We just kind of skipped on updating the federal stuff last year for budget reasons. We do this kind of as a service. This is not something that we go and get, explicit funding to put together. So fostercarecapacity.com, check it out. Check your state's profile. Tips at imprintnews.org if you have some thoughts on what you see in there and what you'd like to see in there. All right, that's going to do it for this episode. Check back next week for our best of. We'll give you 20 great cuts from our best interviews of the year in case you missed any of them. The Imprint Weekly Podcast is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all major social media. This podcast is produced and mixed by Christine Anjoko with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you'd consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, super easy. Just go to imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews, and visit us on the web at imprintnews.org. You can always email us at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.